Patients can expect changes in the way their breasts look and feel after a mastectomy with reconstruction, and a lot of that will depend on the type of reconstruction they've had. How your breasts look and feel after a mastectomy for breast cancer with reconstruction will vary depending on the type of reconstruction you've had. So we'll start with reconstruction with tissue expanders or implants. Generally, your plastic surgeon will review with you what your expectations are, but the way the breasts look immediately after your surgery are not the way that they're going to look when your surgeon is done with the reconstruction. If you're starting with tissue expanders, generally you can feel the expanders under the surface of your skin where your surgeon has placed them in a pocket where they've recreated your breast. The expander is usually deflated, and over time your surgeon will inflate that tissue expander to stretch out the skin so that it creates a nice pocket for the final implant to be placed. During this time, you will experience some numbness of the skin, especially over the incision, but over the skin itself. And when the tissue expander is being inflated, you may notice and feel some stretching and aching of the muscle underneath your breast skin as well. Over time, though, all of those sensations will pretty much come back in regards to the skin envelope. It'll usually start with you resuming the feeling of pressure when you're able to touch the skin, and then most people will feel the regular sensations in the skin over time. If you've had a nipple-sparing mastectomy for your reconstruction, though, please note that the nipple will never really regain its sensation at all. It is there to augment the appearance of the breast, but it will not regain its sensation. For patients who have mastectomy with reconstruction using autologous tissue or tissue from your own body, the appearance and feel of the breast is different from if you've had reconstruction with a tissue expander or implant. So the look of the breast is more like the final version of what your breast shape will look like immediately after your surgery. So your breast reconstructive surgeon will shape the breast as much as possible to reform the breast as it will be in its final stage. And sometimes there are some adjustments that need to be made down the line. But the shape of the breast will pretty much look as much as its final form as your surgeon can make it to be. The feeling will not be there. It's similar to a mastectomy with a tissue expander reconstruction. The sensation to the skin will be gone, there will be numbness there, but over time it is anticipated that the sensation to the skin envelope will return again. And it just takes some time, it depends on the individual, but again, you'll usually be able to start feeling the pressure back again, and then over time, the regular sensation to the skin.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.